This is our first lesson. Okay, yes, back to class.
Yes, ma'am.
Okay, my name is Azima Abdyvalieva. I am oncologist, doctor oncologist, and ultrasound diagnosis doctor. Okay, guys, my English is not perfect. Please forgive me in advance and understand. I am sorry. Okay.
No problem.
Okay, from the course of the lecture, you already know what our subject and its main parts is studying. Okay, please tell me about our subject. What is CHIDIS and its main divisions? What is this Pediatrics Pediatrics? Pediatrics. Tell me about our subject. What is studies and its main divisions? What is this Pediatrics? Please tell me periods of children's development, pediatric sections.
It is a branch of medicine that involves the medical care of infant, children, and adolescents.
Yes.
Its branches are neonatology, pediatric cardiology, pediatric hematology or oncology, pediatric surgery, pediatric emergency medicine, pediatric infectious diseases, pediatric palliative medicine, and pediatric pulmonary, etc.
Yes. Then, good. Pediatric oncologist, pediatric pulmonology, cardiology. Periods of children's development. What is this? Tell me the periods of children development.
Periods of children development.
Yes, periods of children development.
There are 5 stages of the children development: newborn during the first month of life, and then infants develop new abilities in first year of life, and then toddler, preschool, school age.
Yes.
And then
Kiran, how
yes,
long
ma'am.
does neonatal period last?
Yes, ma'am.
How long does the neonatal period last?
Neonatal period 1 month.
1 month?
Infant, no. No.
No. Yes, no. It's not 1 month. How many months?
1 month.
How? 20,
Yes, ma'am. 4 weeks. Yes, ma'am. 1 month.
28 days after birth. It is neonatal period. Yes?
Yes, ma'am.
Yes. How long does the period infancy?
In period about 12 months of life, 1 year.
Repeat, please.
1 year, 12 months.
Yes, 1 month to 12 months. Yes. Good. Childhood period.
About 1 to 3 years.
Yes,
No.
1 to
Yes.
3 years.
Okay.
It is early childhood period. Yes, early
Okay.
childhood. Yes. Okay. Early childhood periods includes the childhood and second period of childhood. Please tell me preschool age. Then it's first period of child. How long does the period?
3 to 8 years.
What?
3 to 8 years.
3 to
5. Yeah, it is, ma'am. 8 years, ma'am.
Kiran, please repeat.
3 to 5 or 3 to 8 years.
3 to 7 years. It is preschool age. Yes.
Okay, ma'am.
And second period of childhood.
8 to 12 years.
7 to
Second,
12.
Yeah,
7 to 12.
7 to 12. Yes, good. And high school age.
12 to
High school age.
12 to 18.
12 to
12 to 18, ma'am.
Good, Kiran, good. You right, Kiran and Muhammad Ali. Okay. Okay, it is you as our extra uterine stage, yes? It is periods extra uterine stage. Wait, yes?
Extraordinary बोल रही क्या बोलूं? Yes, ma'am.
Yes. Okay. And Kiran, tell me intra-uterine stage. Intra-uterine stage. What is it?
Intra
Intra-uterine. Yes.
intrauterine life.
Yes. Intra-uterine
Fine.
life.
It's okay. Life between the conception and birth in humans usually divided into embryonic and fetal periods.
Yes.
Ma'am,
Yeah.
fetal periods. मतलब from periods from conception and birth.
Then
Then, ma'am, what?
you ask our the fetal period of implantation.
Ma'am, there are various stages, like first 2 weeks after the conception are known as the germinal stage, and then third through the 8th week is known as the embryonic period, and then the time from the 9th week until the birth is known as the fetal period.
Yes. Good. And so internatal period. Yes.
Yes, ma'am.
Yes, Kiran. Thank you so
Yes.
much. Good.
Thank you, ma'am.
And, okay, guys, I'm sorry. Okay, guys, Kiran, Kiran, we were told that the period of infancy lasts from 1 to 3 years.
Yes, ma'am.
Yes. Okay.
Yes, ma'am.
Yeah. Okay. Please tell me what is typical for infants?
Yes, ma'am. Typical.
Yes, what is typical for infants?
Typical for infants.
Yes, what is typical for infants?
Behavior वगैरह.
Oh, okay. Typical growth वगैरह जो
No, Kiran,
changes होती हैं.
Kiran, thank you so
Yes,
much.
ma'am.
Kiran, thank you so much. Please tell me Tuba.
Okay, ma'am.
Yes, ma'am.
Tuba, tell me please, what is typical for infants?
Ma'am, infancy is a period of most rapid growth after birth.
Mhm.
क्या बताना है?
Tuba,
Yes,
are you
ma'am.
ready? Infancy lasts from the 29th birthday to the end of the first year of life. Yes?
Yes.
Okay. For infants, typical what? For infants, it is characteristic. What characteristic for infants? Tuba,
Yes, ma'am.
I'm listening you. Okay, Salim, Hafiza, tell me please.
Yes.
Hafiza, your internet so bad.
Yes, ma'am.
Hafiza, tell me. Infants.
What, ma'am?
For infants, characteristic. It is characteristic what?
Ma'am, its characteristics is ma'am, cognitive development. This is the child's ability to learn and solve problems, and speech and language development, fine motor skill development. A newborn often have a lot of ma'am.
And
Ma'am,
Yes.
in infant stage, babies learn to focus on their vision. Is this a characteristic?
Yes.
They reach out, explore, and learn about the things that are around them. Um, and in this state, brain development
Hafiza.
Yes, ma'am.
Okay. You are a doctor, yes?
Yes, ma'am.
Okay. Okay. It is example. It is example, okay?
Okay.
It is example. Okay. You are a doctor and a mother with a child came to see you. What are your actions? Please tell me. Oh,
Ma'am, please repeat.
Hafiza, you have a very loud voice.
Ma'am,
Hafiza,
this noise is from outsider.
Haf- Hafiza, it is
Yes,
example.
ma'am.
You are a doctor. Yes. And
Yes.
after which a child came to see you. What are your actions? Please tell me.
Ma'am, I don't understand.
Okay, I am right you. Okay.
Okay, ma'am.
Hafiza, I am right. Please ready and ask me. That's my questions.
Ma'am, I ask
It is example.
baby's name and
Yes, go. Baby's name, mother's name.
yes, ma'am, mother's name and baby's age
Mhm.
and and ma'am, I ask chief complaint and I ask any complication on birth uh, and chief complaint. And ma'am,
Mhm.
and then after noting chief complaint, uh, uh, I ask about the characteristics of her symptoms,
Good. What is the symptoms?
onset, duration,
Mhm. Yes.
and frequency.
Pregnancy, good.
And frequency extra. It's all good, ma'am.
Okay, and then
Yes, ma'am.
what is the mother's lifestyle?
Yes, ma'am.
Okay, no, it is not. Yes, Hafiza, sorry. Hafiza, tell me please, does the mother's lifestyle affect the child, affect the newborn?
Yes, ma'am.
How?
Ma'am, I asked about mother's history and for example, does she have any chronic disease?
Yes.
Or smoking or drinking can cause problems in baby development.
Yes.
Mother smoking or drinking.
Hafiza, okay, you're right. Thank you.
Yes, ma'am.
Thank you so much. Good. Kira, no, no. Okay. Muhammad Ali.
Yes, ma'am.
Yeah, Muhammad, tell me please. What questions told you ask baby mothers of baby?
Okay, ma'am. So a mother comes to me with her baby, so I will ask the biodata of the mother and the baby first, the name of the mother and the baby, the age of the mother and baby, and other biodata like the general status, the name, age, sex, address, occupation of the mother, religion of the mother, and the marital status of the mother. Then I will ask the chief complaint, what the mother has chief complaint about the baby, and then and then I will try to find out the present illness based on the chief complaint. So then I will ask the mother if there were any complications during the childbirth, um, and was it a premature birth? What was the due date? Did the baby was born on the due date, or was it born prematurely? And how was the post-operative condition of the baby? And all those things. Then I will ask the history of the mother. What was the lifestyle of the mother? Did she have any chronic diseases, illnesses, and are there what is her social history and all those? And is the mother vaccinated or not? And then I will ask her family history. Is there any diseases running in the family like diabetes, hypertension, etc.? And then I will ask her personal history. What would be her level of education, her occupation, how her sources of long and short-term stresses, and with this I would generate her anamnesis, and then I would then form my diagnosis of the baby's condition or problem.
Okay, and okay, Muhammad, and if your mother is not able to answer your questions?
Ma'am, obviously I need somebody who will be a source of information for me, as the baby cannot speak for itself. And if the mother herself does not know what's going on, I would ask her in simple words, what is the problem? What is going on with the baby? Is the baby having problems breathing or anything? And if she still does not know, then I will have to perform physical examination and test.
Okay, good. Okay, Muhammad, please tell me, Mm, what does the objective include, baby?
Can you repeat that, ma'am?
What does the objective include of the baby?
I still did not understand, ma'am. Can you type it to me in the chat?
Okay, I am sorry, I'm right.
Yes, ma'am.
Okay. Please, really?
Ma'am, objective research of the baby. Is that what you're asking?
Yes, yes, yes.
Ma'am, in objective research, we will do a physical examination of the baby. We will do palpation of the baby, percussion, and auscultation of the baby. These are the 4 methods of objective research. So these are what we will be performing first.
This objective resource, yes.
Yes, ma'am.
Okay. And okay. Palpation, percussion, and facilitation. Mhm. Okay. Okay, good. Muhammad, thank you.
Thank you, ma'am.
Muhammad. Hassan Ali. Hassan, you here?
Ma'am, he left the class.
Okay. Okay. Please tell me. Tuba,
Yes, ma'am.
Tuba, what does a child's examining involve?
Ma'am,
What
repeat
does
question.
a child's examining involve?
तो मैंने चैट में क्वेश्चन लिख दिया.
Ma'am,
Oh,
checking child's weight and height.
repeat, Tuba.
Ma'am, checking child's height and weight
Height and weight, yes. So,
and his pulse rate. Ma'am, his pulse rate and vision and hearing.
Then
Then we check his body parts. This is also called as physical examination.
what is a physical examination?
Ma'am, checking different parts of a body of patient.
And
Hearing, vision, etc. And check the color of skin of child.
Okay, Tuba, you should assess the baby's condition, yes?
Yes, ma'am.
Baby's condition is a satisfactory, moderate, or severe. Baby's position, the nervous system, baby's nervous system, skin condition, turgor fabric, bone system, muscle system. Yes?
Yes, ma'am.
Yes. Muscle system, your condition, determination of tone, lymphatic system, anatomometric values, yes? Chest circumference, head circumference, weight, growth. Yes?
Yes, ma'am.
Yes. Cardiovascular system, respiratory system, gastrointestinal system. You should assess that it is yes. Endocrine system, uterine system. Why yes?
Yes, ma'am.
This is a complex of studies, baby. Okay, Tuba, thank you. Guys,
Yes, ma'am.
I invite your homework of the next class, just physical development of children and the assessment of physical development of children. Right?
Ma'am, what books do we refer to for this subject?
You have notebook, guys.
No, ma'am. We usually download the e-books from Moodle, but there is no e-books for pediatrics this time.
You write these books and you read the lecture of the your teachers. I get in both Bekana, yes?
Yes, ma'am.
Yes, okay. Okay, I am these your leader groups, who is leader groups?
Group leader?
Yes, group leader who?
Muhammad Asghar Ali.
Wow. Oscar Ali. He's not present our class. Yes.
No, ma'am. Yes, he's having internet problems, so he did not join.
Just problem. Okay. Muhammad Ali,
Yes, ma'am.
please. You write me number phone.
My number?
Oh no, I am
Oh,
right.
okay. Your number.
I
Okay.
number phone. Please write me. And I am my lecture cup. Okay. It is a physical development of children. Yes. Okay, guys, please tell me structure of the medical history. Baby's medical history. Who tell me structure of the baby's medical history? Who tell me structure of
Ma'am, we have the patient's profile, the biodata of the patient or the identifying data. Then we have the chief complaint. Then
yes.
we have the history of the present illness, and then we have the birth history of the baby or the patient, and then we have the feeding history. We have the immunization history. We have the developmental history, and then we have the past history of the parent and their personal history, their drug history, the family history of the baby, and the socioeconomic history of the parent.
Good, Muhammad. Please tell me what is postnatal and neonatal history? What is postnatal and neonatal history? I have many questions. So many questions here.
Neonatal history, we would be asking how was the birth of the baby, and were there any complications? How was the baby's tone and condition during birth? Did the baby need to be incubated? And how were the vitals of the baby? And for postnatal, I think it would be development of the baby. Was the development of the baby according to expectations, or were there any abnormalities? And etc.
Okay, you're right. Muhammad, good. Tuba, Tuba,
Yes, ma'am.
please tell me what natural history includes. History.
Ma'am, repeat the question.
What is natal history?
Ma'am, it's essentially information. Ma'am, natal history.
Yes.
Ma'am, I don't.
Why, Tuba?
Ma'am, past history of child's health. Ma'am, a key component of history taking involves exploring the parents' cares and child's ideas.
Ma'am, can I answer?
Okay, Muhammad, I listening you.
Yes, ma'am. For the natal history, we have the place of delivery and the conducting doctor or the maid, birth maid. We have the gestation time, the rupture time, the labor time, the type of and the presentation of the delivery, and then what type of analgesics were used during the delivery, if any, and we have any complications. And then for the postnatal history, we would take when was the first cry, which is usually recorded. Then we will take any basic problems. Was there a need for resuscitation or any problems with respiration? Was there any swelling? And then we take the birth weight and if any birth injury. And were there any convulsions, cyanosis, jaundice, fever, rash of the baby? And what were the procedures after the birth?
Good. Thank you. Thank you, Muhammad. Okay. Okay, please, guys, tell your classmates to attend the lecture, okay? The practice class.
Yes, ma'am.
Okay. What?
Nothing, ma'am. That was my sister. I'm sorry.
Okay. Well, guys, you have a homework of the next class. Yes.
Yes,
Yes. Okay. Good. Well, that's the end of our practice class. You need to prepare according to the book. And
yes, ma'am.
okay, guys. So thank you so much.
Thank you, ma'am.
Thank you. Goodbye.
Goodbye, ma'am.
Mhm.